areas where endangered species and low-income neighborhoods coexist. So,
good morning. I'm Dr. Subhani. My name is Zakia Subhani. I represent UHI Clinic. It's a free clinic in the city of Miami Garden. We are there for last 7 years, and we are treating people, people who have no insurance, low-income people, and as everybody knows and everybody said, those are the people who are get affected by environmental changes. Everything, clean water, air, which is necessary, they are the ones get more affected and more. The kids, they have old houses, the pain, we check their lead level, so we try to help them. And then we see a lot of patients with respiratory illnesses, diarrhea, and other illnesses, and even cancer. It's a big thing. Everybody knows. If there is no clean air, clean water, contaminated with all that toxic stuff, so it's going to affect the health of the people, and how much it affects the longevity of the people, the premature birth. There are so many effects that can are the direct effect of the environmental pollution that we have. So we're trying to help them. We have a lot of patients coming from Puerto Rico actually that we have been helping. So we're trying to help as much as can, and we're trying to open another branch in home state in a year or two, because we feel that there are people, a lot of people who will be benefiting from our services there. So hopefully we will be able to do that too. Thank you.
Thank you all so much for your introductions. So I think in order to get the conversation kind of more, fluid, what are some environmental justice issues that are facing Florida and South Florida specifically? I know we've already touched on a few issues, building resiliency, sugarcane burning, but if maybe you all could talk a little bit more about the EJ issues that affect your communities, your organization's members, and what's really relevant and prevalent in South Florida. I think that would be great. So whoever, jump in whenever you want. Yeah, please.
Another thing that in my community that I see that we suffered with was during the hurricane season. As we all see that the hurricane season is getting worse and worse, even though our president don't feel as though it's a problem that's going on, but it is. It's a big problem. And one thing that I would love to see in our community is not for just our community to be one that bounce back from all of the things that happen, but be one that is more prepared for a hurricane. If we could have help getting people with flashlights, battery operated fans, and different kind of equipments where they can have these things already stored, batteries and different things like that, so that when the hurricane comes, then we'll already be equipped. And then also having evacuation plans and different things like that, because we buy a lake. We have a lake that we're surrounded by, and that lake that we're surrounded by is not very efficient right now. It has a lot of problems, and all of us had to evacuate last season. I'm talking about at the last minute, no money, we didn't know what to do, and the people that holds the information of being evacuated, they didn't know what to do. So at the last minute, we like, okay, tell us what it is that we need to do. Where we going at for these people that have nowhere getting around. So it was a last minute thing. So I think that if we could have people to come in that can help us to be more prepared, already give us the evacuation plan, that would be very good for the Glaze area, because it is environment adjustment, because we see year after year these hurricanes are getting worse and worse, and last year was like the worst. Thank you.
Whichever one, we've got plenty.
I kind of want to highlight also something like very, very interesting to me that you said. So I'm from Hialeah. It's the world I do a lot of my work, and for those of you that aren't familiar with Hialeah, it's kind of like northern Miami-Dade County, and it's very, very large percentage is Latino and Hispanic. And I think that one of the things is also just that generally speaking, these types of communities are less engaged because they a lot of the times have to work 2 or 3 jobs. They're constantly taking care of like large families. So when you talk to my mom, for example, when you talk to a lot of my neighbors or these types of communities, oh, this terrible thing is going on, like you know, ABC thing, you know, you should get engaged, or this city town hall is happening. And a lot of the reactions is, I work 2 jobs, like I'm struggling enough as it is, like I don't have time to go at 8 p.m. to the city hall meeting. So I think a lot, one of the big issues is the fact that we aren't reaching people where they are. So a lot of the times we have these community events or engagement events, like during the week when people are working, or at night when people are putting their kids to sleep, or they're taking care of a household, and something that Oceana has been trying to do, and I know a lot of other organizations, I know Catalyst, Miami is doing a lot of work, is meeting people where they're at, going door to door, going to their actual homes, going to different businesses, and communicating the issues that are going on, and then offering some kind of not only education on like this issue's going on in your community, but also just a very easy way to get engaged. Instead of going to the 10 city council meetings on Thursday at 9 a.m. or a meeting on a Saturday at 7 p.m., it's giving them very easy, quick ways to allow them to get engaged. And I know that this is a big problem, specifically when talking about development. I know a couple people here mentioned that, like, you know, environmental racism is a really, really big issue. These kinds of communities are way more, low-income communities and minority communities are way more likely to have some sort of terrible development in the area. And one of the biggest reasons for that, personally, is that you have, these communities don't have the time to be as engaged and as informed in what's going on in their neighborhood. So I think that that's something that I see as an issue, and something that I know many organizations are trying to, you know, bridge that gap.
I would definitely piggyback off of that. The clinic right now is working on a case in Dunbar, and the city of Fort Myers dumped for 20 years lime sludge that contained arsenic into this community, and so we're working to get the city to clean it up. But during our research, we noticed that in this community, which is predominantly African American, every junkyard in the city is in this community. Every industry is there. So not only is it the lime sludge that's in the environment, but it's also the dust and all the toxins coming from junkyards, auto repair shops, and other industry all around the community. And just like she said, a lot of our community members are working 2 to 3 jobs. So, and they have children and they have lives, and it's hard to get involved, and they feel they've been oppressed for so long that they're not really sure how to have a voice. So not only getting all of those things out of their community, but, you know, providing them with the resources and the education to know what to do and how to get those things removed.
I think that's something that is going to be common in what we are mentioning, is that there's a structural problem in terms of environmental justice and social justice. Because the same way that farm workers, for instance, do not have the same kind of laws that protect them in their job, is the same that happens with cities that they are disproportionately hit by contamination, by pesticide, by chemicals in general. There are cities that they are allowed these contaminants to come to their communities because they create jobs. But what's the cause of this creation of jobs? What's the human cost that these communities are suffering to have these kind of low-paid jobs in these communities? So it's always been a problem of structure, and something caught my attention, and specifically right now in this county, when we are seeing what it's transpiring in the atmosphere in terms of democracy on action. Because I think that something that is happening, that something that can change, is that we really take into account that each person is a vote. Each person can make a change. I know that engaging communities is very hard. On the farm worker community, most of these, or many of these workers are undocumented. So they are not going to be able to vote or try to make a change in the system, but we can. Some people that are is able to vote or to actually speak out can do that change. And I think that this generation, these kind of encounters, and we can talk with students and with people that has the capacity of making change are coming to the table.
I just wanted to piggyback on the low-paying jobs aspect. A lot of these mining companies are able to sell the community and the board of commissioners that finally end up permitting these mines that we're going to bring you jobs, and when you're poor and you don't have a job, that might be enough. And you would, make a pretty bad trade just to get that job. So really convincing people that these low-paying temporary jobs are not worth the environmental cost that are permanent for a job that's temporary. It's been a real challenge, but it's one of the focuses that we've been doing up in Bow Valley.
I think one very important thing is that we have, as a person, take an individual responsibility also, because I'm a physician and I'm very much into green things. So my is like we use every day, and I'm guilty of this too. We use this, how many bottles every day we throw, how much paper cups, how much things we are dumping. Then we have, as they're all saying, I mean, in their neighborhood, they have auto shop, there are all those welding shop, all these, they are producing fumes, and that they're mostly, I have seen, they are not in my neighborhood, but I see them when I'm driving where they are, and those people are getting affected. So what the government, when government's regulation should be strict enough, because they should not be allowed to be in the residential area. And then also that, I mean, dumping of the toxic stuff, then you can see that people just come. I have seen they just dump in the neighborhood, and where they can easily do it is the poor neighborhood. And that is affecting the population from children to the adults. So I think it is not only national level, it is individual level, city level, state level, and then the national level.
I was just wondering how many, just because I like to know, how many of you guys are studying like science? Anyone? Interested in science or math or even history? So I got interested in this stuff through more of a social lens. I was interested in racial justice, social justice issues, but I actually studied environmental health sciences with a master's in public health. So I was doing lab work, and I just want to share this with you because I never took notes as a student. I only remember the things that like really shocked me, and that was that the way they do like chemical policy in the U.S. is like really backwards. Like when you in Europe, when a chemical might cause someone harm, like a health effect or something, they ban it like before. In the U.S., they want you to research it to show without a doubt that it's going to cause XYZ disease. So what I think that's something that's so important for you guys to know, because if you do chemistry, I don't know if anyone took chemistry here, when you look at the chemical formula, like it's a drawing of like a pesticide, for example, and you look at the chemical formula of like sarin or like some sort of like toxic gas that they use in like war, it's literally the same, almost exactly the same chemical structure. The picture looks the same. Even if you don't take chemistry, you can see they're the same, just a couple elements are swapped. So it really is the dose that makes the poison, right? So like the stuff that we're spraying on our food, the stuff that we're using in war is literally like the same thing. It's just like the amount that you're exposed to, which is hurting you more than others. And so I just think like understanding that is like really important, especially when we talk about the phosphates and the chemical exposures here, pesticides with farm workers. Yeah, I'd love to talk more if you're science students and are interested in this stuff.
I can give a specific example of that happened very recently here in the state of Florida. I touched on it earlier. In 2016, the state of Florida proposed changes to our water quality, the permissible level of toxic chemicals for surface waters in the state. And the risk protection level for the average person of contracting cancer or another water-related disease from eating Florida caught fish went from 1 in 1 million chance to 1 in 100,000 under this new rule. And for people who were eating Florida caught fish once a week, it went to 1 in 10,000. So I think that really echoes what Zalon was saying, that the way that we look at risk protections for people in this state and in this country is so diametrically opposed to what the rest of the world is often doing. And so we have people who are sitting in legislative positions that are literally discussing the value of a human life. What risk protection level are we willing to put onto a human life? We're willing to just assume that